This is Hina, the voice behind Dr. Teeth. Why smash your head in your textbook when we are here to make dentistry easy for you? So before we proceed to the video, don't forget to smash that subscribe button, and also if you found the video helpful, don't forget to like and comment as it motivates us to create more videos of this kind. For more amazing content, don't forget to visit our website where we have MCQs, courses and much more. So let's begin.
Hello everyone, Assalamu alaikum. I hope that you all are happy no matter from where you're listening to me from. And in the last video we had studied about the left foot 1 fracture, and in this video we are going to study about the left foot 2 fracture. Now if you haven't watched that video, I will leave a link in the description box below, and I would suggest you to check out that video because that is the foundation of this video. There we have discussed about all the 3 fractures in a concise manner. So if you watch that video, it will be helpful to understand this video as well. Okay, now that you have done that, let us proceed with the left foot 2 fracture. Okay, so here we can see that this is our malnourished model. So let us try to understand the fracture line in the left foot 2 fracture. Okay, now left foot 2 fracture happens whenever there is a blow here near the level of the nasal bone. Okay, so as you can see here, this is our frontonasal suture in brown. Okay, so our fracture line, it will run, let me just zoom in. Okay, so here we go. The fracture line will run anteriorly from the frontonasal suture. Okay, and it will reach the medial side of our orbit. Okay, and here in brown you can see this is the lacrimal bone. Okay, so after crossing the frontonasal junction, it reaches the medial wall of the orbit. Here it crosses the lacrimal bone, and then it crosses the infraorbital margin. This is the infraorbital margin. Okay, so it crosses that infraorbital margin, then it turns slightly medial to the infraorbital foramen or passes through the infraorbital foramen. Okay, so here we have the infraorbital foramen. It is passing through the infraorbital foramen in this case. Okay, and then as you can see here, it extends downward and backward. Okay, and here if you look from the back, these are the pterygoid plates, right? And it reaches the middle 1/3 of the pterygoid plate. Now as we can see here, when this fracture is on both sides bilaterally, this looks like a pyramid, right? See, this looks like a pyramid. That is why it is also known as pyramidal fracture. Now this entire block, pyramidal shaped block, may be separated from our skull through this nasal septum, and it may also involve the floor of the anterior cranial fossa. Okay, so let us just have a revision. What happened? There was a force or a blow where at the level of the nasal bone. Okay, here we have our frontonasal suture. Okay, it extends from the frontonasal suture, involves the frontal process of the maxilla. Okay, there it goes to the medial wall of the orbit, involving the lacrimal bone and the inferior orbital margin. Coming down here it involves or it crosses through the infraorbital foramen, just through it, or it goes medial to it, right? And then it's going downward and backward and involving our pterygoid plates. Okay, so this was about the fracture line. Now let us quickly go through some of the clinical features we would see in the left foot 2 fracture. Now since this is a fracture of the middle third of the face, so there will be gross swelling of the middle third of the face, and that is called as the moon faces. Also, since the nasal bridge is involved, there can be illusion of telecanthus called the pseudo-telecanthus. Now what is telecanthus? Telecanthus is the increased distance between the medial corners of both eyes. Here the distance between the two pupils will be same, okay? But since the nasal bridge is involved, it may appear as if the distance between the medial corner of one eye to the medial corner of one eye has increased. So if it has really increased, that will be telecanthus. In cases where we have naso-ethmoido-orbital fracture, means nasal bone, orbital bone and the ethmoid bone all have fractured, in that cases it can be a telecanthus, real telecanthus, not a pseudo. But pseudo will be when the swelling over this area will give an illusion that the distance has increased. I hope I made it clear. There will be periorbital edema, so it will give an appearance of raccoon eyes. So this will be seen in both lephode 2 and lephode 3. The raccoon eyes will be seen in both lephode 2 and lephode 3. If we have injury of the infraorbital nerve, there can be paresthesia of the cheek. There can be step formation or say step deformity at the infraorbital rim or the nasofrontal junction. Now imagine a blow at the nasal level. In such situation, the whole maxilla can be pushed backwards posteriorly. That is the retropositioning. So when this is pushed posteriorly, let's see, this is pushed posteriorly, you can imagine the teeth will also go behind, right, posteriorly. In such cases, there will be class 3 malocclusion and the face will become like a dish face deformity. Also, there will be lengthening of the face. Why? Because obviously the middle third of the face is separating from the skull. Okay, so there will be lengthening of the face. If you examine such a patient clinically and you grasp the alveolus of the maxilla in the anterior region, you can feel that this entire segment is moving, and this movement will be detected here at the infraorbital margin and at the nasal bridge. So these were some of the features of the lephode 2 fracture. I hope that you found the video helpful, and if you want me to cover the lephode 3 fracture also, do let me know in the comment section below, and also don't forget to subscribe, like, because it really motivates me to create more videos of this kind. So till we meet next time, take very good care of yourself, and I'll see you in the next video. Allah Hafiz.